Hi, my name is Caroline Sonny. I'm a cardiologist from Germany with over 20 years experience at university hospitals in Germany, but also in the United States. And now in my private office in Athens, but also doing interventions in hospitals in Athens. I called this talk Heart Under Pressure because we really subject our heart to a lot of stress, and I will go into detail with that with you today. Our heart is a high performance pump. It's actually the most important organ in our body because it's the engine of our whole body. And what it does, it pumps blood to the organ itself, to the heart, through the coronary arteries, and gives oxygen and nutrition to the heart. But as you see on the right side, also to the whole body. It supplies through the arteries and vessels oxygen and nutrients to the brain, to the kidneys, and to all the other organs and our extremities, the arms and the legs. And it's actually a lot of work. Our heart daily pumps 9,000 liters of blood per day. And you can see in the picture on the right side below how much that actually is in comparison to a human being. So quite some work to do. It's quite an exquisite organ. As you can see on the left side, this is our heart with the vessels that you can see that supply oxygen and nutrients to the heart itself. But then also the big vessels you can see here, the blue ones that give blood from the heart to the lungs so that the blood fills with oxygen. And then the red big vessels that give blood from the heart to the rest of the organs that are filled with oxygen, and the blood goes to the organs. And from the inside, you can see the heart on the right side. It's quite complex. We have 4 valves that make sure the blood goes in the right direction. And these are quite complex structures. We all know someone that has had a heart attack, a cardiac arrest, or a stroke. And the reason is that it is actually the most common cause of death. It is more frequent than all other causes: injuries, poisoning, cancers, and lung disease. Most of the diseases that cause death are cardiovascular, is either heart attacks or strokes, and actually the same in men as in women, which is frequently neglected and not known. So every second person, over 50% of people die of a cardiovascular cause. So what can we actually do to not get that far? We have to listen to our symptoms. And there are some warning signs for coronary heart disease or basically heart attack and problems of our heart. The major one is chest pain and chest pressure. So frequently caused by exertion, sport, cold weather, and conditions like stress. We can see on the left side here a typical picture of a man in his 60s who just came out of a hot restaurant, had a big meal, a joyful night, but comes out to the cold weather outside and shows the hand sign. He obviously doesn't feel well and has chest pain. But there are also some other symptoms that we should be careful about, and these are shortness of breath called dyspnea, and frequently associated with cold sweat on the skin, on the forehead, panic, fearful feeling, and the same in men as in women. And of course, also palpitations, like we feel some arrhythmias, tachycardias, or just extra beats. And these are the signs that there might be something wrong with the heart and should be checked out further. So what is the underlying cause of a heart attack, heart disease? So basically we go back to the left picture here where we see the heart and the heart vessels that supply blood, oxygen, and nutrients to the heart itself. And we can see on the right side one of those vessels. This has accumulated calcifications and fat in the vessels themselves. And they cause, as you can see here, reduced blood flow. The blood in the vessel cannot flow the same when there's accumulation of these fatty tissue in the vessel. And what happens with these plaques, if they break, it's like a little volcano. They can close immediately from 1 second to another, one of those vessels. And this will cause a heart attack because the blood muscle in this area doesn't get any more oxygen or nutrients as it needs. And this is a heart attack. And if it's in the brain, a stroke. This is probably one of the most important slides now that I will show in this meeting. So you can make a picture in the end. It is, what can we do to reduce our risk of a heart attack or a stroke? And that's basically taking care of our risk factors. And what are those risk factors that some of you might heard about? The one that is very frequent is actually high blood pressure. And it's often underestimated because we cannot feel it. And if we don't measure it, we don't know. We might have high blood pressure. That might also really cause problems with the vessels, the heart, and the brain without knowing. So really important to check, easy. You can even go to the pharmacy to check your blood pressure. The second one is cholesterol. You can see some fatty meals here, but sometimes you don't, you have a good diet and it's not your fault, but you have some genes and you have some familial hypercholesterolemia, but that's also very important. And something again that we don't feel, we need to check it with blood tests. Also easy, but not to be neglected. Diabetes mellitus is the sugar disease. So if we have increased sugar, this also can be tested in the blood before we get problems. Smoking, of course, something that most people don't like to talk about. A big problem with the vessels, and we'll talk about it. Overweight, which is a problem of the Western countries nowadays, and not to be neglected, inheritance. So our genes, that they play a big role. It's not our fault, but if we have genetic problems, then we really have to be careful with all the other risk factors and get checked up a little bit earlier and more frequently. So all these risk factors that we talked about, they cause arteriosclerosis, which is the calcification of the arteries. That I will show you again and again. Again, it's this vessel that we see in the middle that has cholesterol and other things in the vessel wall and calcification that cause a reduced blood flow, can break and can close every artery from one moment to the next because of the risk factors. So let's start with high blood pressure. It's emphasized too little and it's often not recognized, even though it's so frequent. About 30 to 40% of patients have high blood pressure, called hypertension. And the percentage increases to 80% with increasing age. So 8 out of 10 people have high blood pressure without even knowing sometimes. And until menopause, women have reduced risk, but after menopause, the numbers are actually the same. So that's really important to know. The normal values. So what is a normal value? In the doctor's office, we have a little bit more stress. So there, it's enough that the blood pressure should be less than 140 for the systolic, the upper blood pressure, and 90 for the lower blood pressure. But at home, where we are more relaxed, it's a little bit stricter. So there, the number should be less than 135 or less than 85, which in Greek, we call it 13.5 and 8.5. And that is important for patients. And I tell my patients, once the blood pressure is measured, it's not enough. If we have high blood pressure and get treatment like diet and exercise or even medications, it's important to check our blood pressure regularly and adjust medications. And I give my patients every 6 months at least a sheet that means a little bit of homework where they have to measure 3 times a day for 1 week the blood pressure and send it to me to see that really everything's okay. Because in Greece, there's also hot weather. And in the summer, sometimes we can reduce the blood pressure medications. And in winter, we have to restart them again or adjust them. So that's really important not to neglect this. The second thing that I want to talk about is cholesterol. Because again, we don't feel it. It's often recognized too late and it can be easily checked with a blood test. So do some preventive blood tests, really important. Because if we look at this picture on the right side here, this person has already accumulated cholesterol in the skin. That's really late. So if you show something like this, very very quickly do some blood tests and check up. It's called xanthelasma. What are the goals? Your doctor will discuss this with you, but in general, your cholesterol should be less than 190. And the rest kind of depends on your risk factors. You've had a heart attack. There is the bad cholesterol, which is important, which depends again on risk factors. So if you don't have any risk factors, it should be less than 115, at least nowadays. If you've had a heart attack, then we want to be really strict, and the cholesterol, the LDL, should be less than 70. But this will be done with your doctor. Don't write all those numbers down, it's no worries. Triglycerides are also cholesterols, and they should be less than 150. So the level of the bad cholesterol, the LDL, directly correlates with the risk of heart attack and death. So this is really important to take in mind. Check it and get it treated if it's only diet and exercise and weight loss, or you need some medications. And again, I show you one of those arteries, because if we don't do it early enough, then this cholesterol will destroy our vessels and will cause a little volcano that can close the artery from one moment to another and reduce the blood flow. Diabetes, the blood sugar. More than 60% of patients that are admitted to the hospital actually do have diabetes, disturbed sugar metabolism. Again, this is something we don't feel until something bad happens. So preventive blood test is majorly important for this. And the blood sugar should be in a fasting state where we don't eat anything in the morning, 100 or less. If it's between 100 and 125 milligrams per deciliter, then this is called prediabetes. If it's over 126, it's already a sign of diabetes, and there's some other tests that need to be done. The HbA1c is the long-term blood sugar level that you might have heard about, which gives us an idea how was the blood sugar for the last 3 months. And if it's over 6.5%, and this is a sign of diabetes. It's basically the sugar that is attached to the red blood cells, the hemoglobin, and thus it gives us an idea how was the blood sugar over 3 months. This is a slide that talks about a topic which most people don't like to talk about: smoking. Of course, it's best not to start at all, because actually it's really sad also for us doctors to see patients less than 40 years of age that come to the hospital with a heart attack with no other risk factor than just smoking. And this changes their life forever. Nothing is the same again after that. So it's best not to start at all. But if you want to go with Mark Twain, just give it a try, because to stop smoking is the easiest thing in the world. I've done it over 100 times. Overweight, we said, is a frequent thing in Western countries. I depicted here Germany and Greece for women and men. It's very frequent because of our lifestyle, fast food, and not having enough time to exercise, but also important to improve this. And last but not least, the genes, our inheritance. Did your father have a heart attack? Did your mother have a stroke? Did your grandfather have cardiovascular disease? All heart diseases can be inherited. So if we have some genes or just have these risk factors in the family, then we cannot change that. But we can change all the other risk factors and can check them early, can check them more frequently, and be a little bit more strict with them so we do well. What are the consequences if we accumulate all of these risk factors, or some of them? It actually leads to wear and tear of our vessels. It means our vessels get destroyed slowly by accumulation of cholesterol in the vessel walls, causing calcified plaques, and then stenosis, which means there's not enough space for the blood to flow through these vessels. And if these plaques break like a little volcano, as I said, they close from one moment to the next, and this can cause acute damage to our organs. So in the heart, that will be a heart attack. In the brain, this will be the stroke. And then in the legs, it's the gangrene, the death of body tissue. And we remember this from the pictures of the black legs that we had in the past on the smoking packages. Also, of course, if we have reduced blood flow to the kidneys, this causes kidney damage. And in the end, the vessels themselves can dilate, can break, and can cause aneurysms that can break and can cause major problems. All of these slides above, they sounded very worrisome, but actually there's a lot we can do. We can do ourselves to not get that far and improve things. It means that we have to be a little bit active. It means that we need to do some lifestyle changes. And one thing might be easier for one person and another thing might be easier for another person. As much and more we can do, the better, of course. So losing some weight, which is usually with a good healthy diet, the Mediterranean diet that I will talk about, and regular exercise usually is necessary as well to lose some weight. Alcohol consumption reduction helps a lot to lose weight. And for blood pressure, it's important to reduce salt intake. And in general, stop smoking, as we said, and reduce stress, which might be the most difficult thing to do. But what helps is a healthy diet, exercise, yoga, magnesium, different things. Everyone has their way to reduce stress. Moreover, it's important to follow up with the doctor and to do some blood tests, as we said, to do some preventive blood tests to check the blood pressure and get medication if necessary, if all the above are not enough. So what is a healthy Mediterranean diet? It means a lot of vegetables, fruit, whole grain products, low-fat milk products, and more poultry and white meat than red meat. And especially fish, which is enriched with omega-3 fatty acids like salmon, tuna, and sardines. Good are also nuts and legumes, which are the lentils. And please reduce or just neglect and leave out the butter and the animal fats, and instead use high valuable unsaturated fats, which are basically olive oil. So this should be easy in Greece. Reduce your salt intake, as we said, the sugary snacks and sugary drinks shouldn't be in the diet at all. Just get out the Coke, it's not good. What are typical examinations in a cardiology or in a general office? So basically, a thorough history and examination are a major part that will give your doctor a good idea of where your symptoms are coming from and what else needs to be done. Blood tests are very important for prevention, but also for some of the symptoms. And then, of course, the blood pressure check, which is extremely important. An ECG to see if you've had a heart attack in the past, if you have rhythm problems. It's like a screening. And then also on the right side here, the heart ultrasound that gives an idea, do we have anything from birth? Are there any holes that shouldn't be there? Does the heart pump well? Are there any areas of a heart attack in the past? How do our valves work? Is there any problem? So it's a good, the most useful cardiac examination to get. And then the stress test, which gives us more idea about the blood vessels of the heart, so the coronary arteries, and also the blood pressure under exercise. So it gives us an idea if there's already some of those plugs in the heart vessels that we talked about. And then we see here a Holter. This is a rhythm Holter, but there are also blood pressure Holters, which we wear for 24 hours to see how is our blood pressure in general over 24 hours. And also importantly for the rhythm to see if there's any atrial fibrillation or what are those palpitations we feel. Is it any worrisome arrhythmia, or is it just some annoying arrhythmia which we can treat differently? And last but not least, the vessels that we talked about, especially the carotid arteries that are superficial, and give us a good idea, are there already some accumulations of those fatty structures that we talked about in our vessels or calcifications of the carotid arteries? So a nice test for prevention. And I want to conclude with Hippocrates, with a great saying about 400 before Christ. He already knew it all. So if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. So in summary, cardiovascular disease, so that's heart attack, stroke, cardiac arrest, are the most frequent causes of death, over 50%, and that's the same about in women and in men. Possible symptoms of coronary artery disease or heart disease are chest pain, chest pressure, tightness, shortness of breath, palpitations, dizziness, and fainting, and reduced exercise capacity. To prevent cardiovascular disease, and this is, as you remember the slide I said, it was the most important, we have to reduce our risk factors. And this was high blood pressure, high cholesterol, diabetes, which is blood sugar, smoking, overweight, stress, and inheritance, which we cannot change, but it's important to know, did we have heart disease in the family? And we have to be a little bit more strict with the other ones. Consequences of those risk factors means wear and tear of our vessels, which give our organs the oxygen and nutrients they need. So if we have problems with the vessels and the blood doesn't flow as it should, we get organ damage. And we said that that is at the heart attack, in the brain, the stroke, kidney damage, and all these things that I had said. Typical examinations in the office is a thorough history and examination, blood pressure check, blood tests, ECG, echocardiography, which is the trifix cardiac, the trifix of the heart and the vessels, but also a stress test and Holter tests if necessary for blood pressure or rhythm. The treatment of these risk factors are always lifestyle changes, and you can discuss those in detail with your doctor because that's also very individual, and if necessary, individual medications that can save your life. Thank you for your attention. I hope I could be of help and you understood a little bit of prevention of problems of your heart. My cardiology office is in Athens, Messinias 2, and this is in Ambelokipi. Just give us a call. The number is down here. If you need any help with prevention or you want a preventive checkup, it was my pleasure. Thank you very much for your attention.